Over 60? These 5 diabetes signs could save your life. Welcome to Health Science 3D, where complex health topics come to life through stunning medical visualization. I'm your host, and today we're diving deep into a critical topic that affects millions of men over 60, diabetes risk factors you can actually control. If you're a man over 60, this video could literally save your life. We'll explore the warning signs your doctor might miss, reveal the controllable risk factors that most men ignore, and show you exactly how diabetes develops inside your body using cutting-edge 3D animation. Stay with me until the end because I'll share a simple 30-second test you can do right now to assess your diabetes risk. Here's a shocking statistic. 1 in 4 men over 60 has undiagnosed type 2 diabetes. That means if you're watching this with 3 friends, one of you likely has diabetes and doesn't even know it. But here's the good news. Unlike your age or genetics, there are specific risk factors you can control starting today. And I'm going to show you exactly what they are using detailed 3D medical animations that reveal what's happening inside your body. Understanding diabetes. Let's start with the basics. What exactly is diabetes, and why does it become more dangerous after 60? Diabetes is a condition where your blood sugar levels remain consistently high because your body either doesn't produce enough insulin or can't use insulin effectively. Think of insulin as a key that unlocks your cells to let glucose in for energy. Now, watch this 3D animation as we zoom inside your pancreas. See these beta cells? They're responsible for producing insulin. In type 1 diabetes, your immune system destroys these cells, but that's relatively rare in men over 60. Type 2 diabetes is different. Your pancreas still produces insulin, but your cells become resistant to it. It's like having a key that doesn't fit the lock properly anymore. This is what affects 90% of diabetic men over 60. But there's something called prediabetes that's even more important to understand. Prediabetes means your blood sugar is higher than normal, but not yet high enough to be classified as diabetes. Here's the critical part. 88 million Americans have prediabetes, and 84% don't know they have it. Controllable risk factors. Now, let's examine the diabetes risk factors you can actually control. I'll show you each one using 3D visualization so you can see exactly what's happening in your body. Risk factor number 1. Abdominal weight. Look at this 3D cross-section of the male torso. See that yellow tissue around the organs? That's visceral fat, and it's diabetes enemy number 1. Unlike the fat under your skin, visceral fat actively produces inflammatory chemicals that make your cells resistant to insulin. Men over 60 are particularly susceptible because testosterone levels naturally decline, making it easier to accumulate belly fat. If your waist measures more than 40 inches, you're in the danger zone. Risk factor number 2, physical inactivity. Watch this animation showing muscle cells during exercise. See how they become more sensitive to insulin? Physical activity literally opens up more pathways for glucose to enter your cells. Just 150 minutes of moderate exercise per week can reduce your diabetes risk by 58%. The key for men over 60 is consistency, not intensity. A 30-minute walk after dinner is more powerful than sporadic, intense workouts. Risk factor number 3, diet quality. This 3D animation shows what happens in your bloodstream after eating refined carbohydrates. Notice the rapid spike in blood glucose? Your pancreas has to work overtime to produce insulin, eventually leading to insulin resistance. Men over 60 should focus on foods with a low glycemic index, vegetables, lean proteins, and whole grains that cause gradual, manageable rises in blood sugar. Risk factor number 4, sleep quality. Here's something most men don't realize. Poor sleep directly increases diabetes risk. Watch this animation of cortisol release during sleep deprivation. Elevated cortisol makes your cells more resistant to insulin and increases glucose production in your liver. Men over 60 need 7 to 8 hours of quality sleep. Sleep apnea, which affects 30% of men over 60, is a major diabetes risk factor that's often overlooked. Risk factor number 5, chronic stress. This 3D visualization shows your adrenal glands releasing stress hormones. Chronic stress keeps cortisol levels elevated, which directly interferes with insulin function. Men over 60 often face retirement stress, health concerns, and family responsibilities that create chronic stress patterns. Warning signs. Now, let's examine the diabetes symptoms that men over 60 often miss or attribute to normal aging. Early warning sign 1, increased urination. This 3D animation shows your kidneys trying to filter excess glucose from your blood. When blood sugar is high, your kidneys work overtime, pulling water from your tissues to dilute the glucose. This creates the frequent urination that many men dismiss as a prostate issue. Early warning sign 2, excessive thirst. As your kidneys pull water from your tissues, you become dehydrated, triggering intense thirst. This isn't normal aging, it's your body crying out for help. Early warning sign 3, unexplained fatigue. Watch this cellular animation. When glucose can't enter your cells properly, they're literally starving for energy, even though your bloodstream is flooded with sugar. This creates the profound fatigue that many men over 60 incorrectly attribute to getting older. Early warning sign 4, slow healing. This 3D visualization shows how high blood sugar damages small blood vessels, reducing circulation to wounds. If cuts or bruises take longer than usual to heal, it could be an early diabetes warning. Early warning sign 5, vision changes. High blood sugar can cause the lens in your eye to swell, leading to blurred vision. Many men dismiss this as needing stronger reading glasses, but this could be your body's early diabetes alarm system. Now, as promised, here's that simple 30-second test I mentioned. Answer these 5 questions honestly. 1. Is your waist measurement over 40 inches? 2. Do you exercise less than 30 minutes 3 times per week? 3. Do you frequently feel tired after meals? 4. Do you wake up to urinate more than twice per night? 5. Have you noticed cuts or bruises healing slower than usual? If you answered yes to 3 or more questions, you should discuss diabetes screening with your doctor immediately. But here's what's most important. Knowledge without action is worthless. The 3D visualizations you've seen today aren't just educational, they're your roadmap to taking control of your health. If this video opened your eyes to diabetes risks you didn't know existed, imagine what else you could learn about protecting your health after 60. That's exactly why I created Health Science 3D, to give you the medical knowledge that could literally save your life, explained through cutting-edge 3D animation that makes complex health topics crystal clear. Hit that subscribe button right now because your health is too important to leave to chance. When you subscribe, you'll never miss our life-saving health content designed specifically for men and women over 50. And here's something crucial. Share this video with every man over 60 in your life. Your father, your husband, your brother, your friends. One share could prevent someone you care about from becoming part of that terrifying statistic, 1 in 4 men over 60 with undiagnosed diabetes. Drop a comment below and tell me which of these 5 risk factors surprised you the most. Your engagement helps YouTube show this life-saving content to more people who desperately need it. Remember, your health is your wealth, and knowledge is your power. I'm here every week with new 3D medical insights that could change your life. Subscribe now, hit the notification bell, and take control of your health journey.